We're talking with Dr. Phoebe, and we're going to actually start with eyes, because this is the window to the soul and often can be a bit of a challenge for a lot of people, particularly as we age.
Yes.
What are the sorts of treatments we could head towards then for the different issues that we have?
So for very early mild upper lid laxity, you could try an anti-wrinkle brow lift, where you just put a few little units underneath the eyebrow and lift it up, and that can just sort of temporarily alleviate some of that sagging. The next thing you could do would be something to tighten the skin in that region.
Yeah.
So the Morpheus 8 is a good option to help to tighten the skin. But if you have really significant laxity, the best option really is to do upper eyelid surgery, so an upper lid blepharoplasty.
Okay,
Yeah.
so what would be involved in something like that, and who would it be best for at a particular age or a particular look at the time?
Yeah, so age, some people need it younger, so I've treated some people in their late 20s, early 30s. Commonly, the age is sort of anywhere from 45 onwards. It's definitely something that just gets worse with age. And I think you really know the time to do that is when, if you're trying an anti-wrinkle brow lift and it's not cutting it anymore, if you can't put on eyeliner or eyeshadow without it hitting the top of your lid, if you're starting to feel really heavy and tired towards the end of the day, and if the lines in the forehead are just getting really, really deep from having to compensate by lifting up. So upper eyelid surgery can do two things. Cosmetically, it'll make you look a lot better, a lot fresher, a lot more awake, but also it actually functionally makes you feel more awake as well.
So what's involved exactly then?
Okay, so it is a procedure. So you do need to take 10 days off work. But what it involves is just having a tiny little sliver of skin removed and then stitched together. So you have the stitches in for a week, bruised and swollen for about a week. Then 7 days later, stitches taken out. And then a couple of days later, you can put makeup on and then you're good to go.
Okay. And what kind of results would I expect to see, and how long would they last?
So it's important. I always like it to look very natural. I don't want anyone to look surprised or skeletonized, like they've had too much taken out. So what's left, what remains is important as well. I like for people to just look like they've had a really good holiday, a really good rest, which ties into having a week off work too.
Yeah, great.
But you get at least 10 to 15 years out of it.